Hello everyone, welcome to another episode of Bone Doctor. In this episode, I am going to discuss meniscus injury. It is a type of ligament injury which occurs commonly in the knee joint. Now, first of all, let us understand what is meniscus. Meniscus or menisci are two C-shaped ligaments which are situated in between the two bones of our knee joint, that is the femur and the tibia. The two C-shaped ligaments are called the menisci. There is one medial meniscus and there is one lateral meniscus. These are soft cartilaginous structures, soft yet very tough, which helps to maintain a gap between the femur and the tibia. It acts as shock absorbers between the femur and the tibia and prevents friction in between the femur and the tibia. Thus, it helps in smooth gliding of the knee joint when we walk or we run or we jump. It acts as shock absorbers. So let us understand, how does meniscus get injured? Whenever there is a rotating or a twisting injury over the knee joint, that is, a femur twists over the tibia, that is when you are running and you make a sudden turn, or you have a sudden fall when your body rotates over your legs, then due to the twisting injury, the C-shaped ligaments, that is the medial meniscus and the lateral meniscus, gets injured. In very severe cases, it gets torn. There are tears. This is how the ligament of meniscus gets injured. Now, what are the types of these ligament injuries? There are two types of tears most commonly which occurs in the meniscus. One is a radial tear, another is the bucket handle tear. The radial tear, one part of there is a tear in one section of the meniscus, and in bucket handle tear there is a circumferential tear along the circumference, and a part of the meniscus comes off from the main part of the meniscus. Now, what are the symptoms of meniscus injury? Whenever we encounter a twisting injury of our knee, there may be a popping sound or a clicking sound in the knee joint, which is due to the torn meniscus ligament. The meniscus is torn, and when it tears out, there is a sound. There can be sudden onset swelling of the knee joint, an onset of pain in the knee, and there may be a situation in which the patient feels a feeling of giving away or instability of the knee joint. When a part of the meniscus is completely torn and it hangs like a loose body inside the knee joint, it causes obstruction in the joint movements. That is, the patient may feel locking sensation in the knee joint. That is, the knee may lock itself at a particular position. It may become extended and it cannot be flexed, or it may become flexed and it cannot be extended. This sudden locking sensation in the knee joint most commonly occurs when there is a meniscus injury to the knee joint. How do we diagnose a meniscus injury? Meniscus, as we know, are made out of cartilage, and so if we do an X-ray, we cannot see or diagnose a meniscus injury. Meniscus injury is most commonly diagnosed by MRI. When we do MRI of the knee joint, we can see the position of the meniscus, the status of the meniscus, and if there is any type of tear in the meniscus, it can be clearly visible in the MRI of the knee joint. In cases where MRI is not clear or it is not visible, the surgeon can perform an arthroscopy, a diagnostic arthroscopy, in which he inserts a camera inside the knee joint, by which he can visualize the knee joint and he can detect any tear in the meniscus. So, what is the treatment of meniscus injury? Meniscus, as we know, is an avascular structure. Thus, there is no blood supply present in most part of the meniscus. The margins of the meniscus are supplied by blood vessels. So if there is a injury which is involving the peripheral margin of the meniscus, there is certain amount of healing. If there are small injuries, there can be healing. But if the injuries are large and it occurs in the inner circumference or inner side of the meniscus, that is the avascular side of the meniscus, then the chances of healing is very low. In those cases, we need surgery. In small injuries, we apply ice pack, we give them rest, we give the patients physiotherapy. That helps in healing of minor injuries. If there are large bucket handle tears or large radial tears, or there are certain part of the meniscus is causing locking in the knee joint, then the patient needs surgery. How do we do the surgery in the knee joint? We do it through arthroscopy. That is, we insert a camera inside the knee joint, we locate the injury, and with another port or another hole, we either excise out the meniscus or cut out the meniscus which is hanging loose causing obstruction. If it is a very small tear or a small fragment of the meniscus, we cut it out, we excise it out. If a large portion of the meniscus, there is a large bucket handle tear or a large amount of meniscus is torn out, we repair the meniscus. Meniscus is completely repaired by sutures so that the meniscus functions as normal and helps in normal gliding of the knee joint. What are the complications of knee joint meniscal injuries? If a meniscus is torn and it remains in torn position for a long period of time, it causes increased friction of the femur over tibia, and it prevents the stability of the knee joint and makes the knee joint unstable. That is, promotes early arthritis, osteoarthritis in the knee joint. So if a meniscus is torn for a long period of time and the patient's age is over 50 years of age and there are signs of arthritis, then we don't do knee meniscus surgery, we go for knee replacement surgery so as to replace the damaged surface of the knee joint, that is the femur and the damaged tibia. So this is how meniscus injuries are treated. Meniscus injury need to be diagnosed very early and needs to be treated very early, because if we keep it for a long period of time, it may lead to accelerated osteoarthritis of the knee joint, increased knee pain and problems for the patient. Hope you have got some information from the video. If you like the video, please give a like and do share the video, and if you like my channel, please subscribe to my channel. So that's all for now. Take care. Bye bye.